All right. Social distancing dictates that my patient is my cow today. Hand hygiene. Hi, my name's Stevie. I'm going to be performing a neuro and musculoskeletal assessment of you today. What's your name? All right, Chester, it's very nice to meet you. Could you tell me where you are? All right, could you tell me what month of the year it is? And could you tell me why you're here? All right. Patient is alert and oriented times 4, and there does not seem to be any deficit with their verbal response. Affect seems appropriate for where they are, not overly crying, not over angry. Speech patterns and speed seem normal as well. Chester, could you tell me what you had for breakfast? Okay. And who was the first president of the United States? All right. Recent and remote memory are both intact. Now I'm going to assess facial expressions. So Chester, I'm going to ask you to smile, frown, wrinkle your forehead, crinkle your nose. All right. Facial nerve, cranial nerve 7 is intact. And then I will do pupillary light response. So I'll shine light. Normally I'd use a pen light, but I don't have mine at the moment. So I'm going to dim the lights, and I am going to ask 12 inches away from the patient's face. Shine it into one eye. I'm looking for constriction of that pupil. And at the same time, I will look into the opposite eye and look for a consensual response. It should also be constricting. And then I will do the same on the other. And then while I'm out here, I'm also going to take the light, move in, and Chester's eyes should converge and constrict, showing proper accommodation. Accommodation. Excellent. And normally when I'm doing that too, I'm going to be dimming the lights. So the next thing I'm going to do is I'm going to do extraocular motion. So I am going to continue with my light. I'm going to ask, starting in the middle, Chester, follow this light. Butterfly pattern. Good. Nice and wide. I might show a little bit of nystagmus on the very far fields of view, but I'm not going to see that on a regular basis, especially not in the middle. If I did, that might involve narcotics. So that's cranial nerves 3, 4, and 6 are intact. Right? Yes. All right. And then I could do near and far vision. So I would ask Chester to stand 20 feet away from a wall. I probably have it marked. And I'd use a Snellen chart, and I'd ask him to read the lowest line on that chart. And he would be the top number. So if he was reading at 2050, I would tell Chester, all right, you can read at 20 feet what an average person can read at 50 feet. So then I would also have him use a Rosenbaum chart. In that small chart, have him hold it 14 inches from the face. And again, I'm going to have him hold this and read the lowest line that he possibly can. And then it's on the same scale. So it could be 14 out of 14, but I think the ones that I've seen, they put it into 20/20 scale. So he still has the same 20/50 vision. So then last thing, I'm going to do a confrontation test. I'm going to have him cover one eye, and then I'm going to bring my hand in, and I'm going to have him tell me when he can see my finger. Once he can actually see my finger, he says, I see it. And that's just assessing peripheral vision. Yes. Peripheral vision. Okay. Okay. I'm going to assess, so 3, 4, 6 intact. Now I'm going to assess, and 2. 2 is intact for that last one. That's what the Snellen and the Rosenbaum. I'm going to assess cranial nerve 8. So I'm going to stand 2 feet behind and to the side of Chester, And I am going to have Chester block this ear and maybe wiggle the finger. And then I'm going to stand behind him. I'm going to whisper, pizza, burger, banana. 2-syllable words. And he should be able to tell me what I'm whispering. And then I would do the same on the other side. And then I'm going to have Chester is going to do the Romberg test next. And I'm going to have him stand feet together, hands at the sides, eyes open for 20 seconds. There should be minimal swaying. If he's swaying a lot like this, that's a positive Romberg test, and I probably wouldn't move on to the next part. But Chester has no swaying, so I'm going to ask him to close his eyes for the next 20 seconds. And again, positive Romberg test, he would start moving back and forth, but since he hasn't, negative Romberg test. Cranial nerve 8. Vestibulocochlear nerve is intact. And then I'm going to assess ears bilaterally, making sure they're not tender. I'm going to ask him about pain. I'm going to assess for drainage, color, pain, and then and size. I'm also going to just make sure size is equal bilaterally and everything is equal bilaterally. And then ears. Nose? Yes. All right. So Chester, I am now going to check your nose. I am going to be checking, may not be a good example on him. So I'm going to check position of septum, make sure it's not deviated off, make sure, I might be shining a light up to see, make sure it's not occluded on the inside or there's no inflammation. I'm going to be assessing for drainage, and I'm going to make sure I test both bilaterally. And then for sense of smell, I'm going to ask him to occlude one nostril with his eyes closed, and I will take something that smells cloves, alcohol pad, anything like that, and I am going to put it under it and ask him to identify the smell, both sides. If he can, then cranial nerve 1, the name of which is, this is embarrassing, cranial nerve 1, olfactory cranial nerve is intact. And then here's, I'm going to be assessing the buccal cavity. So I would ask him to open up, and I would just kind of look at the inside of the cheeks, pink, moist, good color, no lesions, no cracks. I'm also going to do the same for the tongue. Should have papilla present on top, pink, moist, no signs of thrush. And then I'll move on and I'll assess teeth. So I'll ask him to open up. It should have 28 to 32 teeth. I'd want to assess maybe with a piece of gauze to see if they're all intact. Particularly important if somebody is going to go into under anesthesia. Assess gum line for gingivitis and redness and swollen. Looking for caries or any signs of decay. Tonsils. So I again take my light, shine it into Chester's mouth, and tonsils should be a 1+ or +1 grade, so barely visible. There should be no inflammation, or they shouldn't be overly large. Uvula, and I'm going to assess uvula, should be hanging right in the middle. Soft palate should also be smooth, moist, red, or pink more than anything. I am going to ask him to open his mouth and say ah, and the uvula and the soft palate should rise on phonation, and that is cranial nerve 9 and 10. Going to also assess gag reflex. Okay, so taking a tongue depressor, I'm going to touch both sides of the pharynx to make sure it's equal all over. And it's important to make sure that the gag reflex is present before we assess for hoarseness of the throat, or before we assess the ability of the patient to swallow. Because if they have no gag reflex, then they will not be, they're at risk for aspiration. To assess aspirate or ability to swallow, then I would ask Chester to take a small sip of water. Take a small sip of water. I'm trying to think of what else. Ears, eyes, nose, mouth, throat. Cranial nerve 9 and 10. 1, 2, 3, 4, 5, 6, 7. 12. Going to... Oh, also to assess the tongue, I might take a piece of gauze and hold on to the tongue, moving it from side to side so I can assess around the sides, most common spots for cancer. And then I'm going to be doing an assessment of hypoglossal nerve. So cranial nerve 12, I'm going to ask to move his tongue around. So cranial nerve 12 is intact if he's able to move his tongue around. Cranial nerve 5, I'm going to ask him to clench jaw, and I should be able to feel the muscle movement, and that's the trigeminal nerve. Moving on to musculoskeletal, I believe. And you go over, I'm going to assess everything bilaterally, make sure size, tone, and strength are equal. Size, tone, and strength are equal. Range of motion for legs and arms and things. Cranial nerve 11. I'm going to assess shoulder movement. So I'm going to ask, myself or Chester to rise shoulders against resistance. And then I'm going to also do the same with neck movements. Turning into, and then pushing chin down, pushing chin up. And then, okay, so cranial nerves, 1, 2, 3, 4, 5, 6, 7, 8, 9. Musculoskeletal. Asking Chester to walk across the room so I can assess his gait, make sure that he's got good posture, he's able to hold his own weight, walking heel to toe. Gait is normal. So musculoskeletal strength. Present. No, what's the next thing? assessments. Okay. Shoulders. Okay. Just lost my light on my camera. Okay. I think my camera might stop recording. I'm going to try to finish this. Okay. We're going to do shoulders. Flexion, extension, hyperextension, external rotation, internal rotation, abduction, adduction, circumduction. Flexion, extension, pronation, supination. Wrist. Flexion, extension, hyperextension, radial deviation, ulnar deviation, adduction, abduction, flexion, extension, hyperextension, circumduction, opposition. In our book, it says circumduction for the finger. I know that Professor Pruitt said that circumduction is only in the shoulders, but I believe our book said that. Hips. I actually have to move this one for this. Flexion with knees bent or flexion with legs straight. Internal rotation, external rotation, adduction, abduction, knee flexion, extension, ankle. Turn this around. I can't do that. Dorsiflexion, plantar flexion, eversion or inversion, eversion,